The experts that care for you at Des Moines University Clinic are more than just clinicians. They're researchers, teachers, and mentors who are training tomorrow's healthcare professionals. Call today or visit dmu.edu/clinic.
Hi there, my name is Alyssa Krieger and I'm a first-year DO student at DMU. I am a part of Anatomy Ambassadors and I'm interested in maybe going to family medicine or pediatrics.
Hi there, my name is Molly O'Brien and I'm also a first-year DO student at Des Moines University in the Anatomy Ambassadors Club. Okay, so jumping right in, today we're going to talk about the aging of the brain and what that kind of looks like. So on this slide here we have the pictures of the 4 lobes in the brain. Shaded in red is going to be your frontal lobe, so that's going to be right behind your forehead. And this is going to be responsible for decision making, voluntary movement, also impulse control, emotional control, any planning and problem solving that you're doing in your day-to-day life. The next one right behind that, shaded in yellow, is called your parietal lobe. And this is going to be mainly responsible for temperature, taste, and touch, as well as some spatial awareness. Right behind your ear, you have your temporal lobe, and on the slide it's shaded in green. The temporal lobe is responsible for hearing and memory integration. So it takes the different sensory information that we're receiving and integrates that and uses it to help create memories. The occipital lobe in purple is going to be right at the back of your head, and that's going to be mostly responsible for vision.
Okay, so next we're going to dive a little bit into some of the common disorders that we see as you age within the brain. As I'm sure you all are aware of, dementia is a very prevalent disorder. We kind of like to think of it as an umbrella term to describe a group of disorders that can affect things like memory, reasoning, behavior, and other higher level cognitive functions like those. Dementia can have a wide variety of causes, including prolonged alcohol use, and is typically linked to some kind of pathological or physical finding within the brain itself. So think about the neurons, those cells that compose your brain. Think about those dying or losing their connections, and then they're unable to communicate effectively with their neighbors in order to do what they have to do. The 2 biggest categories in the US for dementia are Alzheimer's disease, which accounts for about 40 to 70% of all dementia cases, as well as vascular dementia, which accounts for about 15 to 30% of all dementia cases. So to talk about Alzheimer's a little bit more in depth, Alzheimer's is characterized by a buildup of a certain protein that we call beta amyloid. This accumulates outside of the cells and forms plaques, which are never really good if you're trying to get your neurons to communicate nice and well with each other. It's also characterized by a buildup of a protein that we call tau protein, and that occurs within the neurons, the cells themselves, and can form neurofibrillary tangles, which is one of the hallmarks of Alzheimer's disease within the brain. The buildup of these proteins can actually be kind of toxic, and that's when you start to see those really classic symptoms of memory loss, language loss, inability to plan, and other higher order functions like that. On the flip side, we have vascular dementia, which basically just refers to any sort of dementia disorder that is caused more by blood vessel restriction. So if you think about not getting enough oxygen to the brain, your cells aren't going to do so well. They're not going to perform well. And this vascular dementia can come from a really wide variety of causes, commonly things like stroke.
Okay, so that is going to lead us into our next slide. Strokes are a very common thing to happen as we age. Under normal conditions, the brain uses a large amount of oxygen and glucose that we take from our diet to function properly. So the cells are constantly firing to create our thoughts and even controlling things that we don't have to actually actively think about, like breathing. So when someone has a stroke, the blood is not able to reach the brain tissue and therefore cannot function properly. There are 2 main types of strokes listed here. The first is ischemic stroke, and this is going to happen when you have a clot in your arteries in the brain, thus preventing the blood flow. So this kind of happens when we eat a really fatty meal. That it causes an increase in fat in our arteries, and that can calcify over time and build up in the walls of our arteries. This can happen all over the body, and then normal blood flow, high blood pressure, that can cause some of the plaques to break off and travel throughout the bloodstream. Some of those plaques can end up in the tiny vessels in our brain, and that causes the ischemic stroke. So when you don't have that blood to that tissue, the oxygen and the energy resources that your brain depends on are no longer available, and then it can't carry out those basic functions that we need. So the next one is going to be hemorrhagic stroke, and this is caused by high blood pressure or aneurysms that leads to leaky or ruptured arteries in the brain, so that the blood is going to damage the brain tissue, and then also it can't do its job. It can't feed that tissue for normal function. So one thing we really want to talk about here is acting fast. It's an acronym for kind of looking for signs and symptoms of a stroke if you think someone is having one. The first is F is for face. So first you're going to ask the person to smile and look for facial dropping. This usually happens if you're having a stroke on one side of your brain. It's going to cause limited movement on the other side, if that makes any sense. So the person is going to be smiling on one side and the other side is going to look kind of droopy. So the next one is going to be arms. Ask the person to raise their arms above their head, and if one is lower than the other, that's also a very indicative sign of a stroke. You can also ask the person to repeat something back to you. So say just a simple saying, and if you hear any slurred speech, that can be a sign of a stroke. The next thing, the most important, is time. If you notice any of these signs that I've listed above, call for help immediately, and then make sure that you are writing down the time that you first saw the symptoms. This is really important for doctors and medical staff to know, so that they can get the treatment within a reasonable amount of time and hopefully restore blood flow to that tissue before any cell death happens.
And I'll just interject quickly. I did work in an ER previously or prior to coming to medical school, and I know a lot of patients would come in thinking, oh, I'm not really sure, maybe this isn't what's happening. The doctors will always, always, always see you. You'd much rather be safe than sorry. So if you're even seeing a couple of these, it's better to just go get it checked out. So the next topic we are going to discuss is cerebral atrophy. It kind of sounds like a big scary word, but what that really means is that your brain is shrinking. So to a point, this is actually a normal process as you age. It shouldn't look quite as dramatic as maybe the picture that I've posted here, but it is normal to a point. It's kind of a slow process when it's naturally occurring. It can also occur at a more rapid speed with certain disorders like the ones that we've talked about. For example, you can see the picture on this slide. Picture A is of a nice, normal, healthy brain. So you can see the tissue looks very very full. The grooves in all the areas of the brain look a little bit smaller. You can see that the tissue has like a nice firm look to it. It just looks like really healthy brain tissue. On the flip side, if you look at picture B, this is a brain from an Alzheimer's patient. And as you can see, the grooves look a little bit deeper in this one. The tissue maybe looks a little less full. There's a lot more space happening, and just the overall size of it is pretty well impacted by this atrophy here. So when it comes to cerebral atrophy, some areas of the brain can be affected more than others. One of the huge ones that is seen across the board as one of the most common places to have this atrophy or this shrinking is your prefrontal cortex. So if you'll remember back to the first slide that we talked about with the 4 lobes of the brain, your prefrontal cortex is found within the frontal lobe, which was that red one up by your forehead. So this prefrontal cortex, like the frontal lobe, is involved in things like decision making, planning, your higher order functioning, right? Another place that's common to see atrophy or shrinking is the temporal lobe, which is the one that you'll remember is the green one that we showed on the first slide, kind of behind your ear. And that one, as we talked about before, is involved in memory creation, which kind of makes sense if you think about some of the symptoms of these disorders, right? The least impacted usually is the occipital lobe, which was that back purple one, kind of in the back of your head. Um, and that one was responsible for vision changes. So it makes sense that with these disorders that we've been talking about, that would be the one that would be the least impacted by the shrinking, because vision changes and significant vision loss aren't necessarily a hallmark of things like Alzheimer's or stroke. On a more cellular basis, what's really happening here, as your brain is shrinking, you're kind of seeing your neurons, those basic cells of our brain, kind of die off and start to lose their connections with the neurons around them. So neurons communicate via chemical and electrical signaling. So as those synapses, those connections between your neurons die off, your brain isn't able to communicate effectively. I like to think of this as if you were to go visit your neighbor, you would take the sidewalk, walk over to their house, say hi, have a conversation. That's how you would normally do it because you have the sidewalk there, you have the normal pathway there. However, if the construction crew were to come through and take down your sidewalk, you couldn't just walk over there anymore. You would have to kind of yell between driveways. Is that a super effective form of communication? Probably not. Is there going to be a couple of mishaps occur because maybe one person can't hear the other? Probably. So you can kind of think about that little metaphor when you're thinking about what's going on a cellular basis as your brain shrinks. So as we've talked about, this is important for for neuron communication, but the shrinking of your brain is also very important when you're considering the extra space. So as your brain tissue is shrinking, that doesn't mean that your skull is shrinking, right? That doesn't mean that your whole head gets smaller. So you think about the nice healthy full brain in picture A taking up the full skull. There's not a lot of wiggle room. It's kind of, the skull is doing its function of really protecting it, kind of like a nice helmet on there. Versus brain B in the skull, if it's a lot smaller, there's going to be a lot more space and it might rattle around a little bit. And this could lead to things like traumatic brain injuries or maybe even bleeds. This is especially important to consider if you're at increased fall risk for whatever reason, or if you're on blood thinners, because we really don't want to see any sort of injury happen within the brain, because that's only going to lead to more consequences.
All right, so next we're going to talk about some risk factors for the previous things we've talked about. High blood pressure and high cholesterol are two big ones. I mentioned before the high cholesterol can cause the plaque, which you see on the right side, the right vessel in the picture. That's going to be plaque buildup. So again, that can break off, cause the stroke, and high blood pressure can contribute to that problem, as well as the hemorrhagic strokes in your brain. Diabetes, smoking, heavy alcohol use, this also increases the lipid content, the cholesterol content in your blood, and can further cause problems. And then poor sleep is huge. We need that sleep for our brain to rest, heal itself in a natural way.
Luckily, there are a couple of things that we can do in order to keep our brains nice and healthy as we're young and as we age. So I like this. I took this from a website, one of the sites that we one of the sites that we cited down below in the next slide. Chronological age doesn't correspond to biological age. So the number might be different than what your actual brain and body looks like. I think we're all crossing our fingers that our biological age is younger than our chronological age so we can continue to do the things that we love. One important preventative measure, and I'm sure you've all heard this at your annual checkups with your regular physicians, diet and exercise, diet and exercise, diet and exercise. It is so important to keep your body healthy by putting good things into it and using it to do things. You want to make sure you're getting a nice, well-rounded, well-balanced diet, as well as decreasing maybe some of the fattier foods in your junk food. And as far as exercise goes, you don't have to be a marathon runner in order to keep your brain healthy. Even just things like a simple walk with friends or spending some time out in the garden or picking up a new hobby, maybe a new sport or golf or anything like that. Anything that keeps you moving is going to be fantastic for your body and for your brain. If you're a smoker, you would also probably want to consider decreasing your smoking, as that, as Molly talked about on the previous slide, can contribute to that plaque buildup within your vessels. And we want to make sure that your blood is flowing as well as possible. Alcohol use, especially in excess, can also be contributing to some of these issues. So make sure you watch your alcohol intake. Moderation is absolutely key, as I'm sure you're all aware by now. And the final thing that we have listed here is just to stay mentally active. So whether that means socializing with friends or picking up knitting or trying out a new hobby, maybe even just doing, crossword puzzles or trivia games, anything like that is going to be beneficial for your brain in the long run.
Okay, so that brings us to the end of our presentation. We want to thank you all for tuning in and listening to us talk about brain aging and what happens over time. We wish you all the best, and we hope you stay happy and healthy.
Have a great rest of your day.
Thank you.
At Des Moines University's Family Medicine Clinic, our goal is to provide you with compassionate care that is comprehensive. From caring for children to the elderly, our medical team provides holistic preventative guidance on how you and your family can maintain a healthy lifestyle and manage any symptoms that may arise so that you can be at your best. During the current COVID-19 pandemic, maintaining your health as well as a safe lifestyle has never been more important. Our providers are here to help when acute conditions affect you or your family. We treat musculoskeletal injuries, infections, illnesses, and many other medical conditions. As an academic medical center, DMU is training tomorrow's healthcare providers on how to provide expert care to people from all backgrounds. We invite you to visit the Family Medicine Clinic at Des Moines University. We offer the care and attention you deserve.